Good afternoon, everybody. My name is Sonia Diaz, and I am the founding director of the UCLA Latino Policy and Politics Institute. Thank you so very much for joining us today for this important discussion about Latinas and the fight for bodily autonomy. Across the country, Latino communities are growing, and at their core are Latinas. Latinas, unlike their male peers, have some really important data points that contextualize this conversation. They outperform Latino males in terms of college matriculation and graduation. Their segmentation in business and professional occupations outpaces Latino males. And yet, in this country, Latinas have the least amount of money per dollar compared to white men of any population group. And so when COVID-19, along with other intersecting crises, including our fragile democracy and the thinning of constitutional fundamental rights, Latinas are at the center. And one of the things that's really important about this discussion today is that this is about experiences from the ground, leadership rooted in community, and really focusing on something that I think for far too often remains overlooked and inconsequential, and that is Latina life in this country. Research out of LPPI has been following Latinas and their experience over the last 2.5 years during this global pandemic. Our research has found that Latinas exited the workforce more than any other racial ethnic group at the peak of COVID-19. We also found recently in studying entrepreneurs in California that Latinas are facing horrendous income issues, including being housing insecure, having low incomes despite being entrepreneurs, and this is all in comparison to non-Hispanic white women. And so we're asking a lot of Latinas. We're asking them to take a risk, to continue to generate growth for this economy, to continue to be the standard bearers in their most productive years as participants in the labor force, and also to be caretakers of those that are older and those that are younger. And now, in the face of all these challenges, Latinas are being asked again for clearing another hurdle, which is that their reproductive rights are being stripped away at a time when their economic well-being is at the most precarious state it's been in over a decade. And so we've made clear at LPPI that Latinas cannot be treated as disposable because they're the future of America. By 2050, Latinas will represent 13% of this nation's population, 11% of its labor force, and they'll have a median age 11 years younger than non-Hispanic white women. So there's going to be more Latinas, they're going to be younger, and they're important. This isn't just about the economy. It isn't just about political voice. It's really at its core around dignity and citizenship. We know that every issue is a Latina issue, and our panelists today are going to share about the ways in which they are addressing attacks to fundamental rights. And it's about legal rights, it's about our Constitution, it's about justice. It's about Latinas having the ability to make choices grounded in a future that they want to build, not just trying to survive, but being able to thrive. As a Latina-led institute, we're incredibly excited for today's conversation. The team worked to identify all kinds of people to be really helpful to this. I apologize, this is my dog. With that, I want to encourage you to stay to listen to a message from California Attorney General Rob Bonta about the ways in which there can be a California for all, even amidst these constitutional battles. And I want to introduce our wonderful moderator, Astrid Galvan from Axios Latino. Prior to this role, she covered race and immigration as a national writer for the Associated Press. And in 2019, she was a member of a Pulitzer finalist team for national reporting. One of the things that's so great about this panel is really thinking through the ways in which Latina thought leaders, Latina leaders across sectors from journalism to community organizing to advocacy are going to be able to really shine a spotlight on what is happening with the recent Supreme Court decision in Dobbs in a way that I don't think any other conversation is occurring. So Astrid, thanks so much for your time. Audience, thanks for bearing with me and my dogs.
Thank you. Hi, everybody. Welcome. I want to introduce our panelists, and then we'll get some questions going. But first, I want to introduce Kathy Torres. She is a board member and organizing manager for Frontera Fund. We also have América Ramírez, a program director for the Colorado Organization of Latina Opportunity and Reproductive Rights. We have Olivia Juliana, a political strategist with Gen Z for Change. And last but not least, we have Lupe Rodríguez, the executive director of the National Institute for Reproductive Justice. Thank you, everybody, for joining us. So I want to get started with a question about even before Dobbs, we knew that lots of states were adopting restrictive abortion regulations. And I wanted to ask you guys how these laws have impacted Latinas specifically, and where are some of the places that you have seen kind of the more drastic impacts? Any of you guys can take this one away.
I can jump in. Hi, everybody. And actually, I'll just want to make a quick correction that we're actually the National Latina Institute for Reproductive Justice.
Oh, I'm so sorry.
No worries, no worries. But when searching for us, that's important. Or we go by Latina Institute. Yeah, I mean, I think your question is such a good one, Astrid, because it gets to the heart of the point that even before the overturn of Roe versus Wade and the Dobbs decision, our communities, communities of color and Latino and Latinx communities didn't really have access to reproductive health care and abortion care in a easy or affordable or, in a way that we needed and we've needed. And so I think that's important to note. There are many barriers that have existed in the way of folks being able to have access to care, and what this decision has done really has made it even more difficult than it already was. I think one of the things that we've seen specifically at Latina Institute is that because there are already existing structural inequities in access to healthcare for the Latino and Latinx community, we are even less likely now to be able to get care. One of the things that we've noted for a long time is that one of the first entry points for many Latinos or Latinas into healthcare, any kind of healthcare, is reproductive healthcare access. So, that we would go to a Planned Parenthood or another reproductive healthcare center and get other kinds of care for chronic diseases, for other kinds of checkups, and now with this, that's gone essentially in a lot of communities, and so we're seeing that sort of impact. We're seeing, of course, that because of inequities that have existed a long time in terms of employment that offers access to healthcare through health insurance, that we're even less likely, as before we were less likely, but even more so now, to be able to have access to care through places that offer the care without needing health insurance. So as this has, the effect of this ban or this decision has closed down a lot of health centers, that is no longer a place where folks can get even this basic care. And so that's, I think, some of the ways that we're seeing this impact. I think, my colleagues on the panel can talk more about some of the on the ground things we're seeing, but in terms of actually folks being able to get the care they need outside of the states where now there are total bans. But that's sort of some of the kind of bigger picture things that we're seeing at Latina Institute.
And on that note, the economic ramifications are kind of not always part of the conversation, but we know, like you just mentioned, that Latinas and Latinos have lower access to healthcare. And I was wondering if you can talk, or any of our other panelists can talk a little bit about how Latinas suffer economically when they don't have access to safe abortion care.
Kathy, go for it.
Yes, thank you for opening with that, Lupe, and for this great question, Astrid. Frontera Fund is an abortion fund based in the Rio Grande Valley on the border. And so we've had to exist because abortion access has always been very difficult and nearly abysmal in Texas, even prior to SB 8. And so you can imagine Dobbs only made it worse. It just went from 6 weeks to nothing, and adding layers of criminalization that we've already been having to navigate. So in the Valley alone, and I'm speaking that because from my perspective here, because I've lived here my whole life, and that's where Frontera Fund's based, we are already very disproportionately impacted by several systemic barriers as opposed to other parts of the state of Texas, and in the country, really. And it's also not just the Valley, this is across the entire border. So when people don't have access to abortion care, something that they have every right to have access to, this sends a ripple effect in their ability to plan their futures, plan their families' futures, make decisions on parenting, even deciding not to parent. And that's why we have to do this work through a reproductive justice framework, because it really boils down to that. So because we're already impacted by systems that make social mobility difficult, that makes it difficult for people who are just trying to make ends meet, there is an apparent struggle. So we want to ensure that abortion access is available, is an actual real thing, and also unapologetic. Because once we have these conversations about abortion and really hold our elected officials and people in power accountable for inaction, I can honestly say, as being someone a part of this movement for a while and someone who can get pregnant, it's very important that we talk about why abortion access is important, not just from one standpoint, but also, like you mentioned, why we are affected economically as well.
So I want to shift gears a little bit.
Can I just add one thing, Astrid, really quickly, about how, because of what Kathy mentioned about the fact that we, access for many communities has been non-existent for a while. There are actually really great studies as well. So we have data to support what we're saying about the socioeconomic impacts of not having access to abortion. UCSF put together a turnaway study that followed folks who had not been able to receive the abortion care they needed and wanted, and saw, was able to note in a long-term study the economic, the social, other kinds of social impacts on those families. And so I think beyond just sort of like what we know is the effect of this based on our lived experience, there's data to support that this has a really grave impact on communities. And what we're going to see is just more of that, more lack of mobility, lack of access to opportunities, and more poverty, frankly. So it's really concerning.
Absolutely. And I know the Turnaway study has been cited many, many times, but I'm wondering also if you know of any other recent research that people can look to that can quickly Google and look at this data?
Not anything that comes to mind at the top of my head, but I know that the UCSF Center for Reproductive Rights and the Bixby Center has a lot of data on these things. So I would recommend folks Google them.
Thank you. So a lot of people have warned that since Roe was reversed, women and people who can get pregnant are being sent back to a time that was dangerous, of back way alley abortions, these kinds of dangerous situations. But I'm just wondering, from your perspective, whether that's happening or what the landscape really looks like right now for women seeking abortion care. America, can you actually take that one?
Yeah, so I mean, there's a lot of different things that are happening that can make it like just really difficult for folks to access the care that they need. And a lot of what we're realizing is just like there is a lot of challenges around being able to even get appointments. I mean, even thinking about us here in Colorado, right? A lot of folks like to connect or use the verbiage of that, like Colorado is a safe haven state. And so because we have just been able to codify abortion rights within our state constitution, that, right, like a lot of folks are coming to our state to be able to access the care that they need, which is awesome. And, you know, great that we've been able to do that, and understanding that color, Latinas, women of color were the ones that really pushed, were at the beginning of that fight. But even then, right, like that codification and the legality of it all does not also equal, right, the accessibility, the availability, the attainability of abortion care. And so we've seen, especially for young people, right, who are trying to access those services and even just navigate those systems, it's been a lot more challenging, knowing that here in Colorado, we also have judicial bypass laws. And so young people are also having to overcome, right, like going through those processes to be able to attain the care that they need. And so there's just a lot of different things that we've been seeing, especially with like rural areas that already are having a hard time accessing just the services, right? And so I think, Lupe, you were talking about, right, like even just the affordability and the accessibility of being able to go in for regular reproductive health care. Like we are seeing that is just being like, that gap is just continuing to grow and grow, because the fact of the matter is that a lot of people are coming into our state. A lot of folks are just trying to find any open clinic the closest to them. And so as much as they still continue to have that need, and that is very important, but at the same time, that that also puts a lot of added, I guess, a lot of added stress, right, to these clinics and these services. And so for folks that are actually already, you know, living here in Colorado, we know that folks who are undocumented, people that don't maybe speak the language, right, like those are all added barriers to being able to attain the care that they need.
And what is being done about that? I mean, other than, you know, raising money to help people get to places where they can access care, are there any other initiatives or on the ground movements that any of you guys can talk about that are helping people access care at this time?
I mean, for us, it's a lot about also educating, not just like our community, but also these different clinics, and especially the smaller abortion clinics that are in our areas, to talk about that, like because, you know, there is this influx of a lot of donations coming into, right, either advocacy organizations or abortion funds or clinics, and making sure that we're also not letting folks fall through the cracks, right? We've talked a lot about providing language interpretation services, being able to provide stipends and funds for childcare or for transportation, right? Different types of needs that that might not necessarily solely be around, right, paying for an abortion itself. We've also really started to engage in the conversation about self-managed abortions, right, and being able to connect to not just, right, like the I would say like the advancement of science and medicine, but also, right, this connection to indigeneity, and that like we have the power, we are able to manage, right, like, and take control of our bodies, because we also know that the state is not going to be like who saves us, right, and saves our community, and to be able to take matters into our own hand. And so it's a lot of community education, first and foremost, that really helps us kind of change that narrative as well.
I'll just jump in and say, I love what América just said about, you know, connecting folks to resources that exist around self-managing care. I think that if we talk about, you know, the idea from the past about, you know, the coat hanger, the back alley abortion and things like that, that were, you know, a real reality of the way that folks were seeking some relief, right, from being pregnant. And I, while I think that there may be folks who continue to sort of face desperate situations in the current moment, there is so much information. And I think America's point about like what we're doing all together in this network that we have is not letting folks fall through the cracks. I think what's different, of course, is also that we have this information at everyone's fingertips, right? Literally with their phones, like with being able to get this like correct information about what kinds of services they can get, about what funds exist to support people if they wanted to leave places to get care, but also about what they can do to self-manage and how they can do so safely and what resources there are to support them and protect them. There are things now like the Reproductive Legal Defense Fund that supports people if they feel like they might be criminalized for self-managing care. There are a lot of networks of folks that can get folks medication. There are networks of folks who can walk folks through the process. So there's just so much more information. And I think that's a really important thing for the community to hear and know, so that there isn't, so that we don't fall to this, the desperation, the recourse of unsafe methods, right? Because there are options for folks in this day and age, and a lot of information and a lot of support. So I think that's important to note.
Kathy, I want to eventually go back to what you were talking about earlier about the barriers that immigrant women face, especially in border areas. But first, Lupe, can you talk a little bit about, in general, the barriers that immigrants and people of mixed status families face when seeking abortion care?
Yeah, absolutely. I think when I was mentioning at the outset about, inequities that exist in the Latino community and in other communities of color in terms of access to healthcare generally, we know that immigrant communities face some of the biggest barriers in terms of access to care, because we're not allowed to participate in healthcare access systems like other folks, right? Like if you are undocumented in this country, you do not have access to public healthcare systems, and you also can't even buy into insurance plans to be able to get care. Now, those things vary by state. I know in California, more recently, the legislature and the governor allowed for expansion into Medicaid for folks who are undocumented to be able to participate in Medicaid, Medi-Cal in California. But that varies state by state, and really very few states have that kind of program. In general, across the country, if you're undocumented, you really don't have access to insurance, even if you wanted to buy it. And so I think that that's really important. And of course, this doesn't count folks who are on DACA or have other kinds of status, but I think that's the case in general. And then of course we have the 5-year bar, which is another mechanism of keeping folks away from getting access to care, where if you are a newly minted legal permanent resident, you still have to wait 5 years before you're able to apply for Medicaid or other kinds of benefits, right? And so that of course keeps people from being able to get that care. So I think that that's really important. First barrier to care that exists in general, but certainly affects folks' ability to get access to reproductive health care and abortion specifically. And then, just practical things, and I'm sure Kathy and others can talk about this as well, that in this moment, in terms of being able to get the care that you need in a place, like Texas, for example, where there isn't care being provided right now in terms of clinics, immigrant community members have to travel, to be able to get the care, but can't, because what we see is that there are internal immigration checkpoints that are inside the country, even up to 100 miles north of the border between Mexico and the US, that are, on major thoroughfares. And of course, that make the prospect of traveling out of state very difficult, and impossible, really, in many cases. It's sort of the choice of going through these checkpoints and risking detention and separation from your family, or getting the care you need. And so there's just like really practical things like that are happening that are keeping community members from those families from getting this care. And then of course there's just questions of documentation and having identification to be able to travel if you wanted to do so, not by driving yourself. And so just the level of disconnection from systems and structural inequities that have existed for a long time are especially impacting the immigrant communities in mixed status, undocumented in this country because of that, again, these structural things that have existed for a long time. And then not to mention the specter of fear, of criminalization, of detention, and again, of separation from your family if you were to be criminalized for getting this care.
Thank you, Lupe. Kathy, can you briefly talk about what Frontera Fund and any other organizations that you know of are doing to help specifically this population that we're talking about?
Yes, of course. And thank you, Lupe. You painted it exactly perfect. And what's very unique about the Rio Grande Valley is we are quite landlocked. We're right where the coast is at. So we face Coast Guard and the military there. There are 4 checkpoints in the valley alone. 3 you have to face to get out, and 1 to go to Boca Chica Beach that is now being overrun by SpaceX, but that's something else. So there's, on top of already a lot of barriers to care that impact undocumented people disproportionately. There's also the fear of deportation and the high rates of militarization. So we have our local police, and then we have state troopers who we are just completely bombarded with because of Operation Lone Star. And then you have Border Patrol that I thought it was normal, that the amount of Border Patrol we have, I thought that was normal like everywhere else. And I don't ever think I've ever seen an agent anywhere else than here. And then you have the military. So there are a lot of layers of militarization and surveillance that make it very difficult to access abortion care, to leave somewhere else to get that abortion care. And now in Texas, there are no clinics. The clinic in McAllen, the one that 1.3 million people relied on, is also gone. So it's abysmal. So yes, we are in a border area and Mexico is right there, and people have every right and freedom to access care where they need to and self-manage their abortions on their own terms. But that's also not possible for people who are undocumented. And what I love and is very unique to, the Valley and also other communities where we're predominantly people of color, here specifically Latinx, we have relied on storytelling and communicating with friends and family to discuss these difficulties that we face as people and as community members. And thankfully, this very important rooted sense of family is how people are able to self-manage their abortions. If someone's undocumented, a lot of the chance they're staying here with a primo or with a friend who maybe has citizenship or is able to cross back and forth and get them the care they need. So that very community-oriented, holistic care is how people are so able to access to manage their own abortions with dignity. And that's where we come in as abortion funds in Texas. So right now, we still are unable to fund abortions and travel. There's just a lot of risk of criminalization, and truthfully, the laws are so vague that we're doing everything we can to keep ourselves and our callers safe. We're hoping and we're confident that we can at least fund travel soon. We just sued Ken Paxton and other prosecutors, telling them to just you are impeding on everything else that we can do. This isn't just abortion anymore. It wasn't always just abortion, but now it's gone beyond that. So we're filing proactive litigation to fight that. And right now, a lot of abortion funds, we want to help our communities. In Texas, I'm speaking specifically, right? So we are gathering resources, and hopefully soon, at least in Frontera Fund, other funds already have, but sharing resources on where they can go across the country to get abortion care. The closest to Texas is New Mexico. It's still very far from the Valley, but it's an option. And there are funds in New Mexico and all around the country and bordering states that are also here to help. So connecting people with those funds, with clinics out there. Some people maybe need resources to prevent pregnancy. A lot of funds are helping with that, covering co-pays, transportation to facilities where they can access contraceptives. giving people food, diapers, formula, really taking a reproductive justice approach towards care beyond abortion access. Abortion access is a main component to reproductive justice, and that's why we're seeing such a ripple in other ways that people are being impacted because of Dobbs. So right now, we're doing what we can to help people in those ways, but we are still riding hard and fighting for our right to access abortion care with dignity.
Thank you, Kathy. I'm going to shift gears a little bit again. Olivia, I wanted to talk to you a little bit about the political landscape and how it's shifted since the Dobbs ruling. Can you talk about what you've seen? Have you seen people, be really upset and suddenly engage politically? Are people apathetic? Like, what are some of the things that you're seeing on the ground?
I think this time period politically is extremely unique because I think, abortion has been under attack since Roe v. Wade was ruled upon in 1970 and before then. They've been trying to make it illegal for decades now. And I think what we're seeing right now is people often say that abortion access is a very divisive, hyper-political issue, but the reality is it's not. It's not. The overwhelming majority of Americans believe that abortion access should be legal. And I think we saw two really prominent examples of that, first being in Kansas. That is a ruby red, traditionally conservative state where they overwhelmingly voted to ensure that abortion access remained legal in the state of Kansas. And here in Texas specifically, we had seen a lot of people getting registered to vote pre-Dobbs, but the post-Dobbs ruling, there's been a stark increase in voter registrations, and 37% of those voter registrations are people under the age of 25. So not only are we seeing an extremely large amount of people who are getting registered to vote specifically because of the way that abortion is under attack, but we're also seeing an extreme uptick in the amount of youth voter engagement going into the midterm elections. So much so, in fact, I would not be surprised if we saw more young people voting in this midterm elections than we saw in the 2020 presidential elections, because this is an issue that young people are so passionate about. And from an even broader political landscape, for a really long time, politicians who were pro-choice were quiet about the fact that they're pro-choice. They didn't treat it as a priority or as an issue that a lot of people cared about. And now we're seeing politicians who would say the right to choose or reproductive freedom, openly saying, no, abortion is healthcare and everyone should have access to it. And now we're seeing candidates who are running their campaigns around abortion rights. We see it with Josh Shapiro in Pennsylvania. We see it with Beto O'Rourke in Texas. We see it with Val Demings and Charlie Crist in Florida. Politicians and an overwhelming amount of people are understanding the political ramifications of not being civically engaged, of not being bold about your support for abortion and reproductive justice. And I think that within the next few months, even by this time next year, we're going to see a massive political shift in the political ideology and talking points surrounding abortion access.
Yeah, and I think it's really interesting. Axios had a story, I think today actually, about Republican candidates for office who are scrubbing all of their anti-abortion messaging from their websites. So I think that kind of goes along with what you're saying, that the political messaging is shifting. But at the same time, I wonder, obviously the momentum is high, but what does that mean actually going into November, which, feels both like forever from now and too soon. But can you talk about some of the efforts to keep some of these voters mobilized and energized so that they actually show up on election day?
Yeah, I think a really big part of it is actually engaging with candidates and with elected officials and asking the tough questions about what are you going to do? What are your policies? I was very critical in the past of Beto O'Rourke's reproductive justice section on his campaign page. I didn't like it. I didn't think it was in depth enough. And I went back a few weeks ago and looked, and I believe it is the most in-depth reproductive justice issues page I have ever seen. It talks not just about access to abortion care, but it talks about having nurses in rural areas to ensure that people have access to healthcare in general. It talks about OBGYNs and healthcare screenings for cancer. And so I think that what we're starting to see is people really just want to get rid of the hyper political messaging, the marketing strategies. They don't want to hear that. They want to hear, what are you going to do? And are you actually going to be a strong fighter for the American people? And I think the Democratic Party as a whole, our pro-choice partisan politicians as a whole, are starting to recognize that going into these elections. I mean, like what the White House Twitter account did last week, talking about PPP loans or student debt forgiveness, we're starting to see more direct action and fight back on these issues. And I think that that is becoming more and more engaging to people who are getting ready to vote in the elections, to a point now where I think the momentum is just going to keep going. I think we're going to keep seeing more and more direct action coming from not just elected officials, but from on the ground organizers who want to capitalize on this momentum and keep people energized going into the elections.
So I know that you talked about, and the polls show that a majority of Americans believe that abortion should be legal. But there is still a small percentage of people who for religious reasons oppose abortion. Maybe some in your family, I know some in my family, a lot of, hardcore Catholics, right? Who have been taught a certain way for a really long time. Are these people you engage with? How do you approach them? And are they part of the conversation when you're talking about reproductive rights?
Me personally, I find it to be one of those things where it's really difficult to have those conversations. It's something I have as a rule as a political influencer is I will not debate the morality of abortion with you, because you are not going to change my mind and I am not going to change yours. What we can talk about is if you are anti-abortion, but you genuinely want to be pro-family, you want policies that are going to help family, then you can start advocating for things like universal pre-K. You can start advocating for things like affordable and accessible healthcare and funding public schools and pro-family policies that allow children to be raised in healthy environments and allow people to overcome the obstacles that a lot of times are the reasons why people choose to get abortions. One of the biggest factors of people getting abortion care is because they cannot economically afford to have a child. And so if you actually wanted to invest in family planning services and family planning policy, then you can do that and vote for people who do that. You don't have to vote just based off access to abortion care, because abortion bans do not reduce the number of abortions that are happening. They reduce the number of safe and legal abortions, but they don't actually make abortions go away. Those family planning services have been shown to reduce abortion rates. So if you truly want that to be your goal, then you need to support these other policies and get behind those as well. And that's what I usually say put forward when I have these conversations. But like, bottom line, there is a separation of church and state. Our Constitution is not dictated by any one religion. I personally am a Christian. I was born and raised Baptist of all sects, which is even more strict than a lot of other ones. And I think it's unique because even though a lot of people are hyper religious, I know a lot of people who are religious who have adopted the mindset of love the sinner, hate the sin, which is they are becoming more pro-choice. They are becoming more willing to listen. And so I think that you just have to have compassion and understanding when having those conversations, and don't get upset, because if you're more defensive, then those conversations are not likely to go in a very positive direction.
Yeah, and also just wanted to add, I also think the fact of the matter is a lot of anti-abortion people may just happen to be Catholic, but that isn't set in stone on what a Catholic is. I mean, a lot of people who are in the abortion rights and pro-choice movement are Catholic too. So I think it's just that anti-abortion Catholics are just very vocal and in your face about it, which, just like Olivia said, I just choose not to engage. I don't have the time for it. Abortion is a moral good. It's sacred. It's important. It's healthcare. So we're not going to get anywhere yelling at each other. I'm busy, so I think if we just look at Catholicism and as spirituality and your own faith, whether it be Catholic or not, like you yourself have the will to decide on what you want to do with your body and how you feel about choices that you want to make in the future. So just Catholicism isn't a square box. A lot of pro-choice people are Catholic. A lot of anti-abortion people are Catholic. And then you have those that are in between. They're culturally Catholic, but not religiously. Like, it's very common conversation. So I guess choose your battles. Don't waste energy where it will just be that wasted. And let people know that you can be Catholic and pro-abortion at the same time.
Yeah, one of the biggest pro-choice organizations in the country is Catholics for Choice. It's an organization about people who are Catholic and are pro-choice. So I think that's a really good point to make, is like you can be religious and still be pro-choice. Like, I'm a Christian, I'm a practicing Christian, and I'm an abortion rights activist.
I was gonna, and I'll add with what you said, Olivia, like around this question of hate the sinner, hate the sin, not the sinner. Like, I think we've done work at Latina Institute about, this idea of, or a campaign called Yo Te Apoyo, which is exactly that. It's like, you as an individual might not believe in abortion, might not have an abortion, but you are willing and want to support your family and community in being able to have an abortion. And I think that that's another really important part of this conversation about how you approach folks. Like, one of the things that we do, we've been in Texas for a really long time too. And, like building trust with folks and making the connections. Because I think another thing about what Kathy said is like, some folks don't even know that they're like supportive of abortion. Like, they just like have never even thought about it. It's not like the kind of thing that sort of comes up every day for them in their sort of thought, until of course someone needs one or it becomes an issue in the community. And so it's like I think being able to make those connections for folks too about like what this means for your ability to have opportunities and your communities, like ability to have opportunities and access to socioeconomic mobility, like what it means in terms of your ability to care for your family and just like in the context of your entire lived experience. Like, abortion is an important part of it, but it doesn't factor for folks. And I think when we're able to make that connection for community members and again, like grow with them in their journey around like connecting about abortion access and why it's important, I think we can make an impact there. And that's a space, a little sweet spot where we at Latina Institute are kind of thinking in terms of growing power and growing connection with community.
Yeah, and I think to add to everything that y'all are saying too, right? Like, that's where the value of storytelling really comes into play, because we also know folks who have had abortions, right, also have religious affiliations, and to be able to share those stories. We've been able to do at Color and within Colorado and our Latino community all across the state, we've done different pollings around like, how do y'all feel about this? And also talking about different like religious affiliations or political affiliations. And we know, like, we've always seen, as a lot of other studies have shown, right, a majority of folks are in favor of having legality around abortion and understanding, right, abortion as healthcare. And so being able to provide a lot of that storytelling also, right, like takes that control back to within our own communities and talking about these things. And I think what you said too, Kathy, about like, it is a lot of energy to talk to folks. Like, it takes a lot of energy for folks who are like, no, I'm very anti-abortion, blah, blah. I mean, we're not going to persuade those people, and that's not our job either. But ultimately, what the work that we want to be doing, especially as organizers, is to start doing some of that like culture shift. And it doesn't always have to be right with the folks that are going to be like diehard anti-abortion activists. It can just be with folks who are also like, I've never thought about that in those ways, and to be able to build that compassion and that like, this is also a religious value, to be able to say that abortion is a moral good and provides, right, like all of these different things for folks, and really is part of like, right, like our own will and decision making and bodily autonomy. And so I just really like this makes me so excited, because I am also a practicing Catholic, and to be able to know that like, yes, I can't really have that storytelling and talking about like within the organized religion, but I can connect with my friends and my family that are around my age and my generation, and really have like engaging conversations about what abortion really is and the value of abortion as healthcare, as a moral good, as a human right. And also, right, understanding that there's so many different nuances that come with abortion care as well. And knowing that like, I'm not going to be able to encompass that always, and no one else is going to be able to, right? And understanding that like, we need to stay in our own lane in those ways. And so it's a really good conversation for us to have, a very good like relational organizing kind of tactic, right? For us to be able to engage with our circles and start there, right? Is really, really critical.
Thank you. So we have some really great audience questions that I want to get to, and we're running short on time, but I do want to ask one more question about calls for President Biden to take executive action on abortion access. Can maybe Lupe talk about what that looks like, whether that's a good thing or a bad thing? What is your perspective?
We think it's a great thing to call on all legislators, including President Biden, to take action here. I think there are some really practical, helpful things that the administration can do, and frankly have started to do. I will say that we have had conversations with the administration about putting more teeth into the executive orders that have been presented already. What folks need on the ground is resources, which is something that the federal government can deploy to be able to support people. We've called on the administration to call a state of emergency to be able to deploy resources. So these things are still on the table and are a really important part of the picture that we have here. I mean, of course, as Olivia mentioned and others on the call have mentioned, like, we need to be able to mobilize around upcoming elections to be able to have representation that will support and the advancement of legislation and other kinds of things that will provide protection. But the administration can and should be doing something, and so we're working with them to do that. The Department of Justice right now is thinking through ways that they can support attorneys general and other folks at the state level and at the local level, district attorneys, to be able to stand the line against prosecution of folks. They're in court right now looking at the federal protections for emergency access to abortion care, which are really important part of providing care for folks who are like experiencing miscarriage or other kinds of emergency situations, right? Like what we're finding is that there are a lot of providers who are afraid to provide this life-saving care for people right now all across the country because of fear of prosecution and losing their license. And so there are things that the administration is doing to support with that, and where we can, as advocates, continue to sort of raise that up. It's a really important part of in elections and thinking through like who's representing us at these different levels, not just gubernatorial, congressional, but like attorney generals, other kinds of like things across the board. So anyway, all this to say, those things go hand in hand. It's absolutely important that in the system that we have right now, we continue to hold folks accountable, including our president, and it's important that they take action, and we're working to get them to do that. So.
And I really want to highlight here, you said attorney general, like here in Texas specifically, and it's so funny, I literally have a picture right here. Rochelle Garza is running for attorney general in Texas. Like, she has fought for abortion rights in the courts against Kavanaugh and Trump, and she has won. Like, that is the person who is our attorney general candidate here in Texas. And so I think that, like, I've also had conversations with the Biden administration about what we can do specifically for young people, especially on college campuses, like if there's action we can take through the Department of Education. But I think it really goes back to like providing resources for the attorney generals, as you said, and like here in Texas, to have not just this reproductive rights champion, but a Latina from South Texas being our attorney general. That would be game-changing for access to care here in the state.
Yeah, and in terms of the executive order, I do want to say, yes, it is very helpful, you know, that we have a president that is finally speaking up on this issue specifically. What I will say, abortion funding is very specific. It's a very direct service with people actually seeking that care. It is helpful for people who have the means to get up and leave work and go to another state to access abortion care. It is not helpful, however, for people who can't. And those are the folks who reach out to abortion funds. So yes, it was helpful, but I am hoping that more can be done to address who has always been impacted by the efforts anti-abortion people have been pushing forward in states, by things like the Hyde Amendment, who specifically impact low-income people who are seeking abortion care. So yes, it was good, but I would like to see more.
Okay, well, this has been a super engaging conversation, and I just want to move on to some of these really good audience questions. We'll start with, this is an anonymous person, but they want to know, how do you see the wins, this is their words, of our comrades in Latin American countries as inspiration for the fight here for reproductive justice? And can you comment on how each of your respective organizations engage with the sister song definition of reproductive justice, and what barriers you see culturally, and how you perceive being able to call more Latinx individuals into this fight?
Ooh, I love this question, especially as someone who just came from the Sister Song Let's Talk About Sex conference, which I think, yes, it's awesome to see folks that this is where we're coming from. And so that is like our North Star, really, right? Like acknowledging, one, that Black queer women were the ones who paved the way for the reproductive justice movement, which is always deserved their flowers. And right, like at Color, we identify as a reproductive justice organization, and that comes with a lot, right? And making sure that we are also accountable for what that means, making sure that we are abiding by the tenets, meaning that folks have the right to have children, right, in the ways in which they want. And I know whenever I talk to anybody about it, right, I'm like talking about fertility treatments, talking about in vitro, talking about adoption, right? Even the ways that we build families, it doesn't always have to also like cling to babies and children, right? Like the ways in which we build our families, it doesn't have to be conventional or nuclear families. Also acknowledging that folks have the right to prevent and terminate pregnancies as they wish. I think what also gets conflated a lot of the time is that like abortion services are crucial, which, but only because, right, of like rape, incest, if there's a miscarriage, ectopic pregnancies, which is also very, very important, but doesn't mean that like, if you just want to have an abortion, or people always say like having abortions is not a form of birth control. And I would like to say that it can be, right? Like everyone can so choose how they, right, like decide to do that. And so that's part of that, right? Being radical enough to say that that can be true, and being pro-abortion and not, feeling some type of way about it. And then also parenting and having the families, that we already have created and built in safe and healthy and sustainable communities. And that's really important. And where a lot of, I think, the work lies, right? When I give examples, when I'm talking to folks, it's like, that's where the Black Lives Matter movement lives. That's where the school to prison pipeline lives. That's where climate justice lives, right? Like all of these things that are affecting our communities, our families, the way in which our future generations, right, are going to be affected and going to exist within these systems, right, that we are already living in. That's what reproductive justice is about. And so for us at Color, when we engage in policy and advocacy work, and even our organizing work, it's not just about like reproductive rights. It's ensuring that folks, right, I think we talked a little bit about this before too, right? Like there's economic aspects, there's housing aspects, right, that like really affect the ways in which folks, before even being able to like attain an abortion or reproductive healthcare services, folks need to have, right, like the means to be able to get to that appointment, to call to make an appointment, to be able to afford it, right? Like there's so many other things that are happening beforehand. And so reproductive justice means, right, meeting people where they're at in those aspects, not in terms of like, oh yeah, well, I just want to serve you for these needs. It's more of like a holistic approach of like, we understand that like there's so many other things that are happening, and it's really important to not just acknowledge that, but also to change our frameworks in terms of the work that we're doing, right? At Color, we've acknowledged like throughout the pandemic, we really wanted to continue to focus on like, oh yeah, sex ed and providing these services for folks, but then we realized like people just need money to be able to survive. People need this to have spaces to talk about these things. And so we really adapted a lot of our work to make sure that we were meeting those like essential needs first before we could, you know, advance to anything else or ask people to come to the Capitol and give their stories and blah, blah, blah. Like those things didn't matter if folks didn't know what they were going to have, you know, like to be able to feed their families that evening, right? And so it's essential for us to be able to really talk the talk, but walk the walk. And to name the part about like the wins of our comrades in Latin America, I think it's important, right? This decriminalization of abortion. But then there's also still, right, like those culture shifts that are needing to be happening. Right, like legality, I will always say this, the day I die, legality, it will never be enough. And I really appreciate like my colleagues here on the panel that have also reiterated that there's so many other things that need to be happening. But to see, right, like cultural, these other like the Latin American diaspora, right? Like to be able to see that right here in the US and see that happening in other countries can just feel also like, whoa, like we're supposed to be in a developed country. All of these things should be happening here in the US. And so it can also sort of feel like a slap in the face, but in a way, right, we can use it to fuel, right, like our movement here and say like, it is possible here for us, for this generation.
Thank you. And one last one, I think this is on top of mind for a lot of people, is are there privacy repercussions for folks searching online for abortion information in states where the procedure is now legal, such as Google, Facebook, or other tech companies sharing users' data with law enforcement?
I think the answer to that is unknown, but likely. And so there are a lot of resources that folks can look into. Different organizations are looking at how folks can protect themselves. So there are like browsers that exist that folks can use. There are like texting, like Signal and others. So I'd recommend folks look at the Reproductive Legal Defense Fund as a resource for that, to be able to get safe and confidential information about how to do these searches and find information in a confidential way. And then I know that the name is escaping me right now, but there's a cyber defense foundation as well that is helping with this information, and maybe others know what it is, but I'd recommend that folks look that up to be able to find those channels. So they do exist. The Digital Defense Fund, thank you. And they do exist, and folks can use those resources to ensure that their tracks are covered. Because again, we don't know about the normal tech companies and what their privacy is at this point.
Well, that is all the time we have. Thank you so much to our panelists, Olivia, Lupe, Kathy, and América. This has been such an interesting and in-depth conversation. I really appreciate all of your time. And thank you so much to the UCLA Latino Politics and Policy Initiative for hosting this forum.
Thank you so much to all of our wonderful panelists, Lupe, America, Astrid, Olivia, and of course, Kathy. This has been such a thought-provoking conversation, a timely conversation, and important to have so many powerhouse Latinas leading the charge around reproductive justice. It's now my distinct pleasure to introduce California Attorney General Rob Bonta.
UCLA Latino Policy and Politics Institute. Rob Bonta, California Attorney General here, and I'm honored to join you today for this discussion on reproductive freedom and the important role Latinas play in the fight to advance reproductive justice and self-determination. Thank you to the Latino Policy and Politics Institute for centering the experiences of Latinas and Latinos in policymaking. And thank you to today's esteemed speakers. I'm inspired by the activists and thought leaders here, and we need all of you more than ever. A radical Supreme Court decision has put lives in danger. Millions of people are now suffering. From Idaho to Indiana, Tennessee to Texas, politicians are now further regulating bodies and curtailing freedoms. 1 in 3 American women have already lost abortion access. This hurts us all, but especially Latinas and people of color. In recent years, just as state legislatures passed burdensome laws that shut down clinics and put up roadblocks to reproductive care, recent CDC data found a 44% year-over-year increase in Hispanic maternal mortality rates. We are in a new, uncharted level of disparity, and I fear it will only get worse. This moment is bleak. But paradoxically, I also believe this moment brings hope. Olivia, I recently met with your colleague at Gen Z for Change, Sofia Onyele, and I left our conversation feeling so inspired by your generation. I look at her, I look at all of you, I look at my own children, and I see a brighter future. I see a generation of leaders who are fighting for equity and for justice. I see a generation who understands that reproductive rights are human rights, a generation that understands the importance of healthcare and social safety nets. It's often said that young people are the leaders of tomorrow, but from UCLA students to members of this panel, this generation is proving you are the leaders of today. You inspire me to do more, and I am. As California's Chief Law Enforcement Officer, I'm using the full force of the law and the full authority of my office to protect reproductive freedom. We are putting a stop to dangerous Trump-era rules, challenging unconscionable abortion bans, putting misleading crisis pregnant centers on notice, issuing first-in-the-nation guidance to ensure California law is not misused to prosecute pregnancy loss, and far beyond. This moment requires action by all of us, and I know we will continue to answer the call. I know Latina changemakers will continue to lead the way. This is a dark moment for our nation, but together we will be a bright light for freedom, rights, and safety. Thank you for having me. Enjoy today's discussion, and then let's all get back to work.